They can't feel anything.
Ah! Don't go do it. Oh, creepy. This reminds me of the psychiatric hospitals that I used to work at when I was a medical student. I actually lived with 20 of my other classmates in a shut down old psychiatric ward at the hospital where it turned into student housing, and it was pretty plain like this. Oh, oh, oh. Chokehold, using his bicep and his forearm to compress the vessels on either side of the neck, the carotid artery and jugular vein, preventing blood flow in and out of the brain. Pressure on the trachea might make it difficult to take some breaths in. Good kind of idea of what somebody might actually start sensing or feeling. Typically when somebody is starting to pass out, you're gonna get lightheaded, dizzy. You're gonna start getting tunnel vision, everything coming down, maybe seeing some stars. People can pass out in just a couple seconds actually with these type of technique. Doesn't mean you're going to die. If you continue to compress these past the person passing out, yes, you have an increased risk of something more detrimental happening. Whoa, interesting. 3 of everything, right? So we got 3 sets of eyes and 3 noses.
Your nose!
I've never seen this on a human being before.
They can't feel anything.
Ah! But does he bleed? If somebody were to really have this happen to them, that is a very scary injury. You got your carotid artery and your jugular vein sitting right next to each other there. You have your airway, you have your esophagus, you have your spinal cord.
Can you imagine how good that must feel?
What?
You can eat them.
Stop it. Oh my gosh, that's so trippy. That is not what it looks like on the inside of our bodies. Can you actually just grab somebody's tissue super easy and rip through the skin? No, our skin is not designed that way. Unless maybe somebody is very, very old and they've lost the elasticity of the skin. It's very thin. There's not a lot of subcutaneous tissue underneath. Then maybe, because we see a lot of skin tears in the elderly population. If you end up eating humans, historically it has happened,
You're talking about cannibalism.
you do increase the risk of getting some pretty bad gnarly things going on, especially into your brain. Something called prions, basically deposits in your brain, different types of proteins which are not good. What? We're scalping people now? I've actually seen people come into the emergency department after traumatic like car accidents or falls where they've actually had their scalp partially or all the way removed, missing hair, missing tissue. You're seeing the skull. Still survivable, but could be quite painful. Is he gonna put it on his head or her head? That is scary. When doctors do surgeries on somebody's brain, they'll actually typically cut the hair in that area or shave it. They won't typically just remove the scalp itself without, having the ability to put it back on. They want the tissue to put back on. Is that himself?
It's okay. It's just the way we're wired.
You can see that there's the whites of the top and the bottoms of the eye. We actually use that as a clinical test at times. If we notice somebody whose eyes look like that, that means they're probably protruding a little bit, and we're very worried about like hyperthyroidism. Oh! Let me just bite that trapezius. Up here, you have your trapezius muscle. You have the clavicle, which might be bitten into, and underneath the clavicle is your subclavian veins and arteries, so you really have to be careful. These are major blood vessels. You can cause issues relating to significant bleeding and not being able to compress it down because of the bone. There's a lot of blood, and that's just because you're biting into muscle. There's a lot of blood within the muscle, and then if you're hitting any major blood vessels there. Ouch. Thrown against the wall like that, you're hitting your back, you can fracture a rib, you can fracture some vertebrae, or even just a hip or the femur, depending on that force and exactly what area is hitting first. getting slammed on the table on the side there. Your humerus, which is the upper bone of your arm, the single bone from your shoulder to your elbow, can fracture. Those are tough because a lot of times surgeons will let the arm just kind of hang and heal on its own versus actually going in and putting hardware in to have it heal that way. You could also have multiple rib fractures when you're being bent over a table like that. Oh! Go, 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 go. What is this? What is this gas being sent up into the air though? Dangerous gases you don't see, like carbon monoxide. It's tasteless, odorless. So that's why people die from carbon monoxide poisoning. You get very red skin, really bad headaches and altered, but most of the time the color of your skin changing is a late finding. You just slowly kind of just fade away because the carbon monoxide is taking the oxygen off of your red blood cells. Whoa! A lot of these structures are very large. From a medical standpoint, this could be something related to the pituitary gland and growth hormones, meaning like acromegaly. So somebody can have these very large structures when they have growth hormone release at the wrong stages of life. You know, we think Andre the Giant. Traumatic injuries to the right side of the face. When somebody's getting hit here, you can injure the zygomatic arch, injure the maxilla bone here, which also is the maxillary sinus, makes up the infraorbital wall. So you can have injury to this area. You can have injury to the lateral wall as well. We'll see people come in with significant amount of trauma to their faces. We need to get a CT scan, and we always tell people don't sneeze. If you need to sneeze, keep your mouth open. When I think about people getting blood on their face, you think about, oh gosh, you're getting exposure to pathogens, viruses that are in our blood or somebody's blood. You think HIV, you think hepatitis B and C, because they're going to the face, getting to the mucous membranes, and they can absorb into our bodies pretty quickly. When we have people who do get exposures and maybe get liquids on their face, you need to go to an eye wash station, wash out your eye for 10 to 15 minutes, continuous water. It's going to cause some irritation to the eye. That will be fine, but you really don't want it to be absorbed and you really want it to clear out. Oh. Hazmat suits. We've actually been trained to don and doff these, and you have to be really careful when you're removing it. Donning them, not as much. You just need to make sure your area is like clean and sealed, but taking it off, you're potentially in an area where you can have dangers on the outside, so you want to make sure that it is perfect. And typically when you doff them, you're going to have somebody watching you and guiding you and telling you what to do. We didn't do this for COVID, but there are other scenarios where you might want to be in a full body suit like this, Ebola, or anything that could be airborne if there's fluids going around, or if you have an unknown pathogen, somebody's super sick and you don't know the airborne status of it, you might actually throw one of these on. Oh, very cool. We got some imaging here. Hard to know if this is a CT versus just an X-ray. It's 2D, so it's a type of X-ray. You're not seeing any soft tissue. With a CT scan, you'd actually see some soft tissue. Radiographs. But here you're seeing brain, and you're seeing the nose. So this is most likely a CT scan, but also could be an MRI. But typically when you're seeing an MRI, you're actually not seeing like the tip of the nose. Usually it's gone. You're seeing the cerebellum, the vertebrae, the vertebral bodies, the tongue. It's very large, and you can actually see some of the sinuses.
I was hoping to ask you a few questions just for some clarification on our end.
Being looked at like a subject, I feel like a lot of patients sometimes feel this way when they come into the hospital. They're, doctors, nurses, so many people taking care of them. It seems probably quite overwhelming, and it is. We do realize that and hope that we try to ease you as a patient's, anxiety with all the people that are watching.
Could you establish how you got in here?
I walked through a wall.
Whoa.
In the basement of a furniture store.
If you say that as a patient to a doctor and it doesn't make logical sense, they're going to worry that there's something psychologically wrong or a brain tumor. It's so hard for a rational person to believe these things that sometimes individuals that might be going through something really bad or things that are not explained will be dubbed something that's psychosis or an event, so to speak.
In 30 seconds, the pendulum will drop far enough to touch your body. Within 60 seconds, it will cut you in half. All you have to do is destroy the things that have killed your hands.
Wait a minute, what would you do?
What would you do?
It just slices through the top of the abdomen. You have to deal with slowly bleeding out, and you have to also worry about infection. But if you get deeper, if you rupture your abdominal aorta, you're gonna bleed out super fast.
You must insert your hands and push the buttons to start the devices for you. Your bones will be
Oh, if you get your hands cut off, you have arterial bleeding, but it's a smaller blood vessel, so it'll take a little bit longer period of time, and it's a lot easier for you to get bandages to them. Obviously, it's kind of hard with nubs, so to speak. Save yourself, man, let's go. See, he's trying to get out of it. What do you think? Not gonna work. Oh my gosh, I'm getting nauseous. How long would it actually take for somebody to die of these injuries? It depends on how much blood is actually pouring out of your body. Some people have lost blood over a very slow period of time and the body's been able to compensate.
I ain't got time to bleed.
Versus in an acute injury where you just pull out blood. Like thinking about this from a realistic standpoint. Go, man. Go, 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 go. Oh, it's slow. A lot of the red stuff, the hands, they're getting crush injuries. A lot of times crush injuries don't bleed that much. They ooze out because you're not actually slicing, you're actually just crushing the tissue. But until it gets even deeper, will you have that significant amount of bleed. Now this gentleman is quite skinny, so he doesn't have a lot of adipose tissue or fat underneath his skin. You have a higher chance of definitely hitting major blood vessels. In the abdominal wall, you're actually worried about some blood vessels that are kind of on the side of your six-pack, so to speak.
Here is your first test.
Oh, it's got a CPAP machine on or a BiPAP. That's actually a pretty good mask. Typically we use that type of mask in somebody in the hospital who has sleep apnea or say they have bad CHF, congestive heart failure, to where they have fluid in their lungs and they can't breathe.
He's got fluid. Your health and hereditary background put you in the highest category of success. The same cannot be said for your adversary.
Oh.
While only 52 years of age, this man has continued to smoke even though he has a history of high blood pressure. We
actually do use it in people who have bad COPD, chronic obstructive pulmonary disease, which is a combination of chronic bronchitis and emphysema. And it's due to people smoking. Sometimes it can be a hereditary deficiency as well.
This demonstrates very little appreciation for the blessings of his own life. Your game will focus on the simple element.
So it's interesting that he calls it a game. This almost reminds me of Squid Game, that show on Netflix where they have to do different things between life and death.
Once this game begins, every time you take a breath, the clamps around your chest will close in and crush your body. The only escape is in the other's failure.
What? In a situation where you're freaking out and your adrenaline is up, you're gonna breathe faster because your cardiovascular system is working hard because you're anxious. To be able to try to slow down your breathing, you gotta get into a Zen place, and I don't know how you can get into a Zen place in this situation.
You're messing with my Zen thing, man.
Ooh, big breath. Oh, no. Oh. So very common when people get very nervous, scared, they'll urinate themselves. It has to do with the muscular control of the sphincters relating to the bladder itself. Oh. In this situation, the person died immediately. Could that really have happened? If you have such an injury to the heart itself where you rupture one of the ventricles, yes, you're going to die very, very quickly because you're going to pull blood out. You're going to be unconscious first. If it doesn't get fixed, you're going to die.
I want to play a game. It's right before your eyes.
Oh no. He put the key behind his eye. I want to know how he's got surgical skills to be able to do that. There's a lot of muscles in the way of that. How is it actually just resting behind there? We don't have that much room and extra pockets to put things. Oh, don't pull the device. Oh my gosh, he pulled nothing works well out of aggression.
Until you learn to master your rage
will become your master?
Oh my gosh, he's got a scalpel. It looks like it's either a 15 or a 10 blade. it's so hard to do. My one suggestion would not be to cut through your cornea, because the cornea is the highly sensitive area of the eye, which is basically the clear coating over top of your iris and your pupil. Super painful if you touch it. So I'd go to the white area where there's less nerves. You couldn't do it. Oh, man.
That's a shame.
Could you do it? You can injure the eyeball itself, get all the fluid out, squish it, move it out of the way. The other thing you could potentially do, cut here at the side, but the issue ends up being you have all the muscles and the optic nerve that are keeping the eye in place. So those have to be cut. Oh geez, why is she like, was she like given something? Maybe she's waking up. Oh, there's a syringe with yellow something in it. The only stuff that's yellow is TPN or a banana bag. TPN is what we give people who can't eat, different electrolytes and nutrients in there. Then there's a banana bag, which is very similar. It's like a multivitamin that makes it that color. Oh! Oh no! Oops, and now her hand is caught. No, don't put two hands in. If she had just one hand in there, she could at least lift the blades out of the way, but now both hands are going to be stuck. Oh no, yep. Yeah, oh my gosh. So a lot of times we'll have people who do have wounds like this or superficial wounds that we just have to sew up. Really easy to sew these lacerations back together unless they're deeper to where you have tendon injury or a major vessel. Sometimes you can actually injure a nerve.
Whoa! What the is that?
Whoa.
It's the tool. The tool that's going to save your life.
The tool that I use in the emergency department that saves the most amount of lives the quickest is probably the defibrillator. And then obviously the staff there is an instrument in itself. Without them, we wouldn't be able to save lives.
As a drug addict and a thief, you preyed on the kindness of others to fuel your addiction.
A lot of people suffer from substance-related issues. We have resources to help people, but you can't force anybody to help themselves. We'll help guide, but I can't actually set that up for you.
You just lean forward into the knives with your face. Press hard enough,
Oh gosh.
and you'll release the arm or leg restraints that bind you.
Your temporal artery sits right here in the temporal area. Feel like that would get sliced right open. It's a small blood vessel. You can hold pressure to it once you're through this. Sometimes arteries have to be put back together by a very skilled and trained vascular surgeon or trauma surgeon can do it.
You can sit idly and bleed out on the floor. Live or die, Cecil.
You're gonna go in and out of consciousness. You're gonna become delirious from not being able to sleep. You can not eat for many days, but you need hydration. Your body's gonna start shutting down even if you don't bleed out.
The timer expires. The door in front of you will be locked forever. Just one hint as to where that key is.
Oh no, not good. You gotta use some sort of protection. Literally at work, whenever we're finished with the needle, it has to go into a sharps container so that way it's not just left in the trash by accident, left on the counter and you don't know. Like as a physician myself, any needle that I use, I literally make sure that I put that away.
It will be like finding a needle in a haystack. Let the game begin.
If the needle still has some blood in it, you can actually inoculate somebody else or inject it by accident, and there could be bloodborne pathogens that might be transmitted that way, like hepatitis B and C, and then obviously HIV. Oh! 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 Ah! Ouch. It made it sound like it was like glass, but all of those syringes are probably plastic, but the needles themselves are potentially all metal. Ow! What's wrong with you? She found the key? How the heck did that happen? Oh my gosh, yeah. You had enough time to put the key in and you screwed up. Oh my gosh. You idiot! I know some people are terrified of needles. I've seen many people pass out in the hospital from needle sticks, but I always tell them, don't worry, this is the best place to actually pass out if you're gonna pass out.
Safest place in the world to be.
Hello, gentlemen. You came looking for the game. Congratulations. You found it.
Oh,
You're the
found the
final
game.
2 players.
Never good when there's a weird contraption around your neck, especially with like this weird breathy voice coming over the loudspeaker. It is literally like the seat collar from hell.
Can't be. You may recognize the device around your collar, Dr. Nelson.
Dr. Nelson.
These laser cutters slice through tissue and bone.
Oh, laser cutters. We don't get to use those in the emergency department. You gotta be probably really careful with them. They might be attached to robotic arms or something that's super stable versus these free-form devices.
You both have an opportunity to live. All you need to do is confess. It's that easy.
Oh my gosh, oh my gosh. I wonder if those lasers can actually cut through other material outside of flesh. Why wouldn't it be burning a hole through the ceiling as it just went up?
I confess. Yeah. Okay, all right.
Oh.
All right, John Kramer, it was me. It was me. I messed up your x-rays.
Oh, he was doctor that messed up the x-ray. Sometimes doctors actually do mess up. They're human beings and they either dictate or write something in the wrong chart or leave something out. They might have missed something. These things do happen.
I should have been there for you. I wasn't.
Oh, I was expecting his face to be cut like a cake where it was into pieces, right? How quickly could somebody succumb to these injuries? Just all depends on how quickly the blood is leaving the body.
The device you're wearing is hooked into your upper and lower jaws. When the timer in the back goes off, your mouth will be permanently ripped open. Think of it like a reverse bear trap.
Oh, I've never seen any bear trap injuries in the emergency departments that I work, but I bet they do occur in areas where hunting would go on. I work more in an urban setting, so the likelihood is a lot lower.
There is only one key to open the device. It's in the stomach of your dead cellmate.
Oh, what? Oh, no, don't freak out. Okay, you got the lock. Remember, if anything gets attached to your head, don't just like rip, turn around. You don't know if it starts things, okay? Oh, he's not dead. I wonder if he was given certain medications to keep him from being able to move, or was he paralyzed from the neck down because he was opening his eyes? Big, huge scalpel to the abdomen. I definitely wouldn't be chopping that way. If you're gonna cut the abdomen open, you want smooth stroke like what they do in surgery. And then just do a layer by layer, get in there, move tissue around, spread it open so then you can get to wherever this might be. Oh, she got lucky. Is it ripping your face off, but is your airway still intact? Rip all the way through to where it messes with the spinal cord in the back. Depends on where the fulcrums are and all that stuff. I hope I never find myself in a situation where I would even have to deal with that.
The human body is a miraculous creation. Ever wonder how far the arm can twist?
Oh my gosh, for twisting? It looks like it's screwed into the hands and the feet. So you can actually go between the bones of your hands without fracturing. We see injuries where people accidentally get a nail and the bones are actually fine. It squirts right through.
Are you willing
Have mercy.
to take a bullet for the man who killed your son?
Whoa. Oh! Rotating, that is so painful. When we have somebody who dislocates their shoulder, we'll actually do external rotation of the shoulder. It's hard to get it all the way to 90 degrees. Now you're actually rotating in this direction even further. Ouch. Ouch. Oh, so it's held in place. It looks like it's rotating at the elbow. We're made to rotate like this. It's called pronation and supination. It's made to do that, but not to great extremes. Oh, the leg. Oh, the leg. Oh my gosh. Oh no. 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 We don't see too many rotary type injuries. Typically, there'll probably be more of a snap of the tibia itself. The patella can go side to side, but that's easily fixed.
The device you are wearing is hooked into your rib cage. By the time this tape is finished, you will have 1 minute to find a way out.
You got hooks or barbs stuck onto the ribs. We actually do procedures where we cut open the chest and lift the rib cage off.
There is a single key front of you. All you have to do is reach in and take it. But do it quickly. The acid will dissolve the key in a matter of seconds.
There's a bunch of different acids that we always worry about. Hydrofluoric acid, hydrochloric acid, bad pHs that will burn tissue. Oh! You could still actually live for a little while with the ribcage gone.
She's gone!
It's a protective layer. When you fracture and break off all those ribs, you're gonna have some bleeding. So it causes a lot of pain. Are you going to die right away? No, actually. So that one's very, very interesting.
As her device begins to rotate, it will pierce her eyes and mouth. Step into the other machine and lift the bars to the highest position, long enough to close the circuit, slowing down her device.
So rotate to enucleate.
Nuclear.
Gouge the eyes out. But then on the opposite side of the eyes, you got your brain. If it penetrates deep enough into the brain in certain areas, it may not be sustainable with life. Oh, every time he lifts it, he's gonna get punctured into the abdomen. Oh my gosh! If you're getting impaled in the abdomen, going through the different muscle layers, and then you have omentum that sits right underneath the abdominal wall muscles, which is like a fatty layering over top of your organs. Oh man. Oh my gosh, see how they're actually cut? They're actually beveled. Beveled just like any type of needles that we use when it comes to IVs that are hollow like that. One end is like a point and then it's like a cup, but it's sharp all the way around, and it just has to do with getting into tissue a lot better. Oh, goodbye. Pain in your eye would be of like the cornea, which is the clear cells that are over top of the colored parts of your eyes. Super sensitive to painful stimuli. And wow, I've never seen that type of impaled type injury to someone's face. I don't know if it would be like a fountain of blood like that. Obviously there'll be some blood, but there was a lot of extra red stuff, if you know what I mean. Ooh. All these like contraptions, just having previous experience discussing medieval and dark age type contraptions, these are just as bad or even worse. Fluid. Is he gonna drown him? Is it just water? Yeah. Somebody can hold their breath for 30 seconds to a minute. It's different for every individual, and it changes from being in a calm situation where you're holding your breath now to where you're kind of freaking out, increasing your oxygen more to your tissue. So you actually really need to calm down. Obviously, so much harder than me just saying it. Trying to use a knife or a pen to try to break the glass. Oh my gosh, holy cow. So, wasn't expecting that. He takes out this pen and does his own crike. He's putting it below the Adam's apple. You want to pop right in.
Pop, pop, pop.
To your trachea, below your vocal cords, and you can start breathing. That's pretty impressive. Wow. I don't know if anybody's tried to breathe through a straw. It's actually kind of hard. When we intubate somebody at the hospital where we put a breathing tube in, we actually try to use the largest we can. Typically try to get an 8 French in there. So a good sized tube.
One who has given the most flesh will release their bindings, while the gears on your opponent's head will engage, piercing their skull. Who will offer the most flesh?
Offer the most amount of flesh?
A pound of flesh.
Fingers and tissue and arms. And, oh my gosh. Oh my gosh, the screws in the head. Awful. That is actually your temple area. When somebody actually needs a halo for cervical immobilization, that's kind of an area where they'll actually do it. Ouch, but these are like rusty old screws. Holy cow, get to cutting some tissue off. Oh, he's cutting his own skin. Oh my gosh. Did you know that the skin is the largest organ of our body? Oh, tourniquet. Oh, using a tourniquet. This is like the ones we use at the hospital. A little bit of blood flow to pump up the veins so you can engorge the veins so you have an easy shot to get an IV or get blood drawn. And then you actually take it off once you actually get in the vessel. So you're probably going to be using this to decrease the blood flow to chop off our own arm. Cutting off a finger, that's hard. You're not gonna be able to cut through. Oh my gosh, they're doing it by weight. That guy has such an advantage because of the adipose tissue or the fat tissues that he has. but it is painful. The girl has to worry about bleeding out. I don't know if that tourniquet's going to be tight enough. It needs to be super tight to stop the flow 100%, and it actually is quite painful, but probably not as painful as missing a limb. There you go. In this circumstance where it was amputated, you definitely have a higher chance of having something called phantom limb syndrome, where you still actually think that the limb is there. Hopefully, in this circumstance, if she gets out, maybe she can keep her limb, and because it was such a clean wound, you might be able to reattach it. Hopefully that weighs enough. Things that we see when people come to the emergency department when they actually have an amputation. Typically, it's not a smooth cut like that. Typically, it's all broken tissue, bones are all in pieces, and it's just one big mess.
It's a man!
Whoa. Screws going that far in, again, causing bleeding into the brain. Would it actually cause you to die right away? Probably unlikely, but it will make you die quickly, but not that fast.
Make the simple blood sacrifice that I've requested.
Oh, Nelly. Whoa. Looking at the blades, they are probably 3 to 4 inches maybe in depth. That's going to potentially go into your thoracic cavity where it could actually sever part of the lung, sever basically part of your heart. Oi! So laceration to the forearm. Obviously, we're going to get an x-ray if that comes into the emergency department. We'll get the bleeding to stop.
I just don't know how to make them stop.
Because it's on the forearm, we typically will actually use lidocaine with epinephrine. The epinephrine will actually constrict the blood vessels, so you have anesthesia for a lot longer.
Cut yourself! You need to cut yourself! You want blood and then you're free!
You can take off your own finger. Oh, wow. When we see people who come into the emergency department with all these lacerations, typically they'll actually go to a certain part in the emergency department where it's more like a fast track. All you need to do is make sure the bone's not injured, maybe an x-ray, make sure there's no foreign bodies, and then have the wound looked at, anesthetized, cleaned out really well with water. Depending on how deep it is, you may need to do multiple layered closures, or do you just need to be able to bring the tissue back together? Typically in the emergency department, we do simple interrupted sutures where it's one individual with multiple knots, depending on the size of the suture. What? Oh my gosh, that would be so scary to wake up attached to a very jagged looking circular saw. Oh no. Laceration to the chest, you're hitting the sternum right there. It takes actually a chunk out. You do get an issue when you're missing a bunch of tissue. You need to have sutures that are in place that actually can anchor a little bit better. Oh! Oh, right in the abdomen.
Abdominals.
Multiple layers, right? You got the skin, the subcutaneous layers, then you're getting into the musculature, the rectus abdominis muscles, your 6-pack, or sometimes people have 8-packs. Then you get into the omentum, which is covering internal organs there. And then you're having some different layers of fascia. You're soon gonna get into the intestines. Oh man, I love fake intestines. They look kind of real, right? They look like thin tubular structures, but they're not free formed like this. They are attached by mesentery. Then she appears to have succumbed to the injuries. But would it actually occur that fast? If the blade cuts through your major blood vessels there, you can die pretty quickly by bleeding out and pooling out. But it's gonna take couple minutes.
The decision of which to survive falls upon you.
Oh.
But remember, the mounted gun will continue to fire until all 6 rounds are spent.
What? Shotgun can have different types of size bullets, so to speak, in it, where it could be one big slug or it could be multiple small bullets and could spread out, but from this distance, it typically stays in small grouping. Correct me if I'm wrong out there.
And if no decision is made on your part, all 6 will perish.
Oh my gosh, there is something true about paralyzation of action due to fear and stress. You even think about the phrase a deer in headlights.
You must press both buttons at once in the box before you. However, in doing so, you'll give a sacrifice of your own to live, for will die.
Oh, so he's going to have some pain. Okay. Oh. Gunshot wound right in the middle of the chest. What structures do we have right in the middle of the chest? The heart's center left, and then you have your aorta that comes right off the top of it. You have your superior and inferior vena cava, and also your lungs. Oh! That puncture wound could snap the bones, so your metacarpals of your hands, or it can go in between them, injuring the soft tissue, but also hurting because that is where the nerves run through next to all the vessels.
You are all connected. A cable runs through your collar devices. It can be pulled so tight that you will be decapitated on the mounted razors.
This situation, it always reminds me of the guillotine, right? Back in the day, they always thought that there was consciousness that maybe lasted up to like 12 to 13 seconds. But again, you can't study this stuff, and we don't have really good documentation of it, and they've kind of debunked it.
The only way to remove the collar is with the keys from the glass boxes. However, if one of you moves to retrieve a key, the 60-second timer will begin for you all.
Oh, every time there's always that one person.
Every time.
So whoever's strongest is going to be able to pull their own cord. Compression on the front. When people pass out from being choked, it's multifactorial. It's either related to squishing and compressing the trachea, or decreased blood flow by compressing down the major vessels on the sides. And now none of them can do it. Oh. Ah. Breaking the glass, will that cause laceration or injuries to your hands? Not necessarily, but going through it and hitting the sides potentially could, but it's not guaranteed. What? When this gets cut, you got all the major blood vessels there, and then you're severing your connection from your spinal cord to your brain and all the information that goes to and fro. And we have an autonomic nervous system that's in there. I'm not a fan of these face contraptions. All I can remember is just snapping off. Oh. Keep going. Ouch. Trying to break the thumb so then the thumb can actually slip underneath versus dislocated. Probably trying to break it at this point. We don't see a lot of thumb dislocations. We see a lot of regular digit dislocations or fingers. The thumb, just by mechanism, you typically see it fractured. Oh, that was smart. Whoa. He had to rip through it and rip the side of his cheek. Masseter muscles, his pterygoids, muscles of the face having to do with opening and closing your jaw. Very much repairable. You might just have to have the mouth shut for a little while. Oh, Nelly.
Hello, Detective Boswick. I want to play a game. The 3 train is arriving in 2 minutes.
Oh my gosh, he's being held up by his tongue. That tongue looks like the same tongue we would see when somebody starts to get angioedema of the face, where the tongue just starts swelling and starts getting really, really big.
Either that or my mouth is getting smaller.
Tear from your mouth the tongue that has so often been used to lie and to deceive. Take a leap of faith and you will live. Only your weight will rip away your lying tongue and save you.
The tongue bleeds so much. Sometimes we bite our tongues and it hurts like heck, but when the tongue gets severed, whoo, you gotta make sure that you get something to compress it to get the bleeding to slow down and stop. Oh, see, right at the last minute, he would have made it.
Missed it by that much.
You know, people don't show up to the emergency department after being demolished by a train and into lots of pieces like this. I could just imagine the body exploding like this. Wow, good job with the anatomy. If you ripped that all out and survived, he'd have bleeding into the throat, would run the risk of just choking on his own blood and asphyxiating. Oh, a hot cup of coffee spilled right into your crotch.
And hot.
That skin in between you know where is like super sensitive, super thin, can get 1st degree, 2nd degree, even 3rd degree burns. Oh no. Oh my gosh. That individual has no chance at that point. I don't care if you have airbags or a seatbelt. We all know this. You don't need to be a doctor to figure this out. Okay, laid down the bike, slid on the ground. You increase the risk of road rash. He's wearing full leathers, which is good, and is away from the bike because the bike itself can cause trauma. Oh, gentleman slammed right into a tree. You're thinking severing your spinal cord because of the amount of force that you land into a hard, and then your bike comes in again going, 40 to 60 miles an hour, right either in your legs or the abdomen. It just depends on where it hits you. With this car flipping, we actually see a lot of people that actually fly out of the car. And so when EMS gets on scene, we always ask, where was the individual found in relationship to their vehicle? Were they tossed from it? Did they just get out of it? Oh my gosh, still alive, simple injuries, scratches, you're wearing the seatbelt. Obviously, everybody wears a seatbelt. The airbags might have not been in, they might have not deployed because of not as much frontal injury. Oh my gosh. Like, these are the worst luck ever. We do see people that come in after a car has been on fire. You do worry about not only just like burns, but the materials that are burning. So you always worry about like potentially cyanide poisoning. The SUV slamming into the tree again, flipping over. Survivable? Yes. EMS will probably put you on a backboard, put you in a seat collar. Oh my gosh. Holy cow. Okay. A water bottle getting stuck underneath the brake. It's not unrealistic. So just be careful what you have in the car and, keep any obstructions away from the driver's side at least. Oh no.
Way too warm in here now, huh?
Tanning bed.
Huh?
Tanning beds, no good, okay? They increase your exposure to UV radiation, which then increases your risk for skin cancer, melanoma, as well as aging of your skin, thinning of your skin. Oh my gosh. Holy cow. Oh no, they're locked in. I'm pretty sure there is an emergency button in these things that you have access to, but typically you end up panicking, tachycardia, increased blood pressure. You're not necessarily basically thinking as clearly. Oh my gosh, melting. Oh, it's getting shattered. The glass is shattering, so you worry about like simple lacerations. Likelihood that you're going to lacerate a major artery is probably pretty low because most arteries are quite protected by where they are anatomically in our body. Oh my gosh, dude. I was not ready for that. This is awful. Really, there's not much to do at this point. You have melting of your airway potentially as you breathe in the flames. You're having the fire itself taking the oxygen away from you in that area, so you're becoming hypoxic. So you have a double whammy. What? Okay. Massive amount of suction to the buttocks could cause a hematoma to the area, basically a large bruise where a lot of blood vessels are going to pop. That's so much. Oh, I see what's happening. He's going to drown. He's panicking, which then is going to decrease the ability for him to hold his breath, and he's going to run out of oxygen quick. Stop it. I have literally seen where somebody's rectum prolapses, aka comes out.
Put her back in.
Like literally involutes the other way. So it looks like this big sausagey looking thing, and it's very tender, it's painful. There's a nerve endings, it could bleed. What? I don't know anything about pools except going in them is fun and hanging out with your friends, but could it actually do that to somebody? That's crazy.
I can't move my head.
Perfect. Just what we want. Here comes the drop.
Okay, so device so you don't move your head. I'm assuming this is like an ophthalmologist putting drops in the eye.
And you will feel a little numbness.
Numbness drops. So we typically use either tetracaine or proparacaine. All the meds that end in cane pretty much are the anesthetics. So lidocaine, bupivacaine. Oh my God, the ominous music. Don't tell your patient to relax. It's really an inappropriate word. It's really hard to relax when somebody's sticking metal in your eye.
Is that supposed to be happening?
Where's the doc? Typically, a ophthalmologist would do this potential laser therapies. A lot of times when somebody is in these type of devices, they're doing other therapies by hand versus the machine. Somebody needs to be manning the machine, somebody needs to be around. Slow, man, oh my gosh, oh my gosh. I'm not an eye surgeon, not for me. Wow, look at that. It's like cutting through regular flesh and tissue.
What? What is it, Norm? Wait.
Those hooks are prosthesis for individuals that obviously don't have an arm, and the hooks help grab. That's why those are there. Oh! Oh no. Oh my gosh. Could blood come out of your mouth? Because we know that is the view that we all get in movies, shows. In this circumstance, it actually could work in the sense of crushing an airway, crushing the neck. Oh. Oh my gosh. What would you do if that happened in real life? Decapitation. You lose the connection of the brain to the body, so heart and lung function will cease because there's no more information. You still have oxygenated blood in your brain, but is there consciousness? That is $1 million question, and really nobody knows the answer to it. The likelihood is no.
Who wants to be the first to tell me what the hell just happened? Who's what?
Oh, man. Could definitely do this to somebody because of the speed and the weight of the wrench. Blood, kind of appropriate in what you're seeing pooling. It's very dark. You wouldn't see it as bright because there's probably more venous blood than arterial blood coming out. Right behind your eyes, your frontal lobe, but then going further back, you're going more underneath that frontal lobe right into your midbrain. All of a sudden the person is out cold, unconscious. This person could just be massively like brain dead versus did it hit that area and cause you to succumb to the injury. Oh. Okay. This is like one of those classic lifts to help somebody get in and out of the pool. We actually use these at the hospital as well. We call them Hoyer lifts, but they're basically lifts to be able to help move individuals so that way the people moving them don't hurt themselves and it's comfortable for the patient as well. Whoa, okay, so somebody intubated, so that's a breathing tube into the airway on a ventilator. Actually quite appropriate. You got an IV line going behind, and that is a classic tube holder that somebody would have in place. Sometimes if you don't have a tube holder, you can actually use a piece of tape and twist it around the tube as well. Oh, come on, getting electrocuted.
Come
on! Hospitals use so much energy because everything requires electricity. Hospitals actually have really good backup generators as well. Oh, it's a lot of water. Nobody's noticing this massive amount of water. Come on. Come on. Pools up on high floors. I mean, shouldn't they be down like on ground level or below ground? Oh, so he was able to extubate himself. At the end of that breathing tube, you have a balloon cuff that keeps it in place in the trachea. You pull that out, you can actually rip your vocal cords, really injure them. What? Come on. Come on. That amount of water, gallons and gallons of water, the amount of weight that is going to crush the individual as well as potentially drown them. Maybe the initial impact is going to cause a significant amount of trauma to this individual, which then could lead to the demise. Wow, cool. We get some x-rays. Run over by the car. All the ribs, the spine falling into pieces. Comminuted, displaced. What that means is all the structures that the ribs are protecting are going to get destroyed as well. Oh, getting driven by the truck into the wall, causing rotatory injury to the cervical spine. You see all those jagged lines on the skull? We all have them because our bone was actually fused. It's interesting that they give us a little bit of the red stuff, even though it's an x-ray. You wouldn't see that normally. All the teeth come flying out. The teeth are actually pieces. That means the roots stayed in and the teeth all just fractured. If this happens to you, go find that tooth, see if it's something that we can potentially put back in. But if it's broken like that, the likelihood is no. Oh, wow. I mean, sometimes you feel like you need to get a good massage, but not that aggressive.
Ooh, are those things even sterilized? No, I'm not catching any diseases unless I've earned them.
We won't talk about that. But this is acupuncture, a traditional Chinese medical technique to basically help bring about balance and healing energy to the body using very, very fine needles. I've actually even had it done to try to help relieve muscle spasms. Oh no.
Oh. Hey, fire!
When somebody gets a burn to the skin, 1st degree, 2nd degree, 3rd degree, and even 4th degree. Holy cow. 1st degree, it's like a sunburn. 2nd degree burn will cause blistering, will pop, and then your skin will heal. 3rd degree burn, everything is charred, won't heal on its own, needs to be replaced with skin grafts. 4th degree burn, it's all the way down into the muscles and the bones, and really not a good scenario. Come on. Come on! They even show like the top piece of a vertebrae just like hanging out there. We got different types of material. Softer brain material, you got skin, you got skull. Typically, if this were to happen in real life, you wouldn't get that much splatter. Oh, I love the intensity of the propane grill.
Propane.
Okay, normal behavior. Oh my gosh, so you heated up the mug. Now you're gonna put something super cold, increase the risk of cracking the mug. Duh.
Knew it.
Oh, come on. Come on. Remember, don't pull it out, but this is the classic reaction that people get. Depending on where the injury is, if it's a vascular problem, you literally now have a faucet of an open bleeding vessel. Where this stab wound is actually probably a little low relating to the heart. That's like the lower part of the sternum, right at the xiphoid, maybe the epigastric area where the stomach is. You might want to go potentially a little bit higher into the left. That way we know, okay, it's definitely the heart. Oh, I What was that? What would you do if you saw that? I don't know if I would even handle it like, well, like what the heck just happened? Is this survivable? Probably unlikely. The potential is this individual might still have a pulse. They may succumb to the injury pretty darn fast, but you don't know. So you do need to check. Oh, what the heck? The amount of brain tissue that's gone, this would likely not come to the emergency department, but I have seen patients that come in with exposed brain matter. We still resuscitate to a point, but a lot of times once we see that and they're not alive, we stop. What? We don't see these very often in the emergency department, and you all know why. But if you're getting a traumatic injury to the side of your head, you worry about the ear itself on the outside. You get bleeding in the ear, you run the risk of getting like a cauliflower ear. People who do boxing, wrestling, MMA, bystanders get splattered with somebody else's blood, which increases the risk of transmission of bloodborne pathogens to somebody else, especially if they get in your eye. Mouth, potentially. Eye, more likely because of the mucous membrane and absorption.
You okay? Nothing wrong?
Oh, jeez. Oh, man. Come on.
Come on!
Oh, hitting the back of your head is quite common. People fall backwards, hit the back of their head. You will bleed. You'll probably either have an abrasion where it goes partially through the skin versus all the way through the skin. And majority of the time on that spot of the head, we will use staples. Oh my gosh. Oh my gosh. Oh! Oh my gosh. I think his noggin comes flying off. We don't see it in the emergency department. Not viable with life. We sometimes will see internal where somebody has really bad cervical spine injury to where they may be paralyzed. They may have poor respirations or no respirations. Something about a leg. Survive that whole thing and your leg's not working the way that it should. I'm assuming the adrenaline coursing through your veins will give you enough oomph to get up and move quickly. Seriously?
Really?
Sometimes we will see people who get hit by trains. Sometimes it's just an abrasion, maybe a fracture, dislocation. But if it's full force, they don't make it to the emergency department. When somebody does get a trauma accident like that and they're alive, they're going to a trauma center. Oh gosh. Ambulances, first responders, they definitely drive fast. Typically, if they are exceeding maybe the speed limit, then they're gonna be lights and sirens, so you should be aware. Oh, man. Wow. You see the tissue of the individual like on the ground. They did a good job of depicting it. That does happen. You'll see tissue, you'll see bone fragments, you'll see body parts. You can see brain matter as well. Oh, geez. Some embers, get a light on fire, snap. Come on. Come on. House fires, explosions, gas lines are running through. Could happen. We worry about carbon monoxide poisoning, smoke inhalation as well. It can cause pneumonitis, so irritation of the lungs, inflammation, or set off people's asthma as well.
Don't worry about me. Go save your sister.
Lots of burns to the face and chest, almost melted over the right eye itself. We get real concerned about the face because we're worried about the airway. We're going to be looking up the nose and looking into the back of the throat. Indications that the fire went into those areas.
I love her. Peter.
Oh my gosh. Now, what do I always say? Don't pull it out. Straight through. Does it go through the heart? Could you have missed the heart? If you look at it, there is a potential chance. But going through your lungs, the mediastinal structures, potentially through your aorta, and you definitely ruptured through the diaphragm, maybe part of your spleen, maybe your liver, part of your stomach. Could that have you succumb to your injury immediately? Maybe.
Maybe.
All depends on the structures that are hit. You're not going to be beating efficiently. You're going to pass out. Everything will start shutting down. Versus, do you pass away that second? Only if your heart really stops. But again, you're going to pass out first, and then you probably have another minute or so of being alive-ish. People do fall on asphalt. When somebody is not able to brace themselves, they take a lot of hit to their back, but then they have whiplash and hit their back of the head. CT scan, make sure you don't have a skull fracture, intracranial bleed, because what happens is that your brain sloshes around and it can have a coup counter coup movement, so you can actually have bruising to the front of the brain as well as the back of the brain. Oh my gosh. Being dragged on the ground can cause road rash, just like when somebody's having a motorcycle accident and sliding. Your jeans don't have that much abrasive resistance, so they can rip, and then you start ripping through your own skin. Yeah, burns like that, your difficulty breathing, it's taking away your oxygen so the flame can grow. It's probably going to be melting your airway, and it's going to cause you to go into cardiac arrest.
Cardiac arrest! Brian, I think you better go check that barbecue.
Oh, hey, careful.
Oh my gosh. Watching these treacherous injuries reminds me that sometimes life's occasional stresses can just hit as fast. That's why Chillax by my company Life Happens could help out to ease the tension and bring those calm vibes. Check it out at lifehappens.com or on Amazon. Oh. I do see some other type of explosive injuries, not to this extreme, but if somebody was around an explosive, things that you worry about: collapsed lung, perforating your ears, injuring hollow organs, if you're getting burned or shrapnel, so any devices that might be flying at you that can cause penetrating trauma. Oh, can't get out of the car. Oh gosh. Oh my god, it's Stifler! It's Stifler! Yeah! Car accidents, train accidents. Say you got into an accident, you're on the highway. Get away from the vehicles, especially if there's still cars going by. People are not paying attention, picking up speed, not noticing that the car is broken down and slam right into it, and you can get into another accident. Oh my gosh. This is where Stifler goes. I know it. Oh no. Wow. Right through his mouth. You could actually see that because he's still having the lower jaw intact of the body. So interesting. You'd have a lot more bleeding, but that is awful. Oh no, of course.
Of course.
In emergency medicine and in trauma medicine, anytime you fall from greater than 3 times your own height, you always want to consider worst case scenarios. It doesn't mean that you're ultimately going to have really bad outcomes. It just means that the index of suspicion needs to be high. One small piece. Oh. Shards of glass can also get embedded in the hand or the tissue. We'll get an x-ray of somebody to see if there's actually any pieces of glass still in somebody's tissue. If there is, we got to go find it and try to get it out of there. Sometimes we can't, and you'd actually have to have a continuous x-ray done, trying to navigate the tissue to get it out of there. Whew. What? This movie is disastrous. At least we got some anatomy where we're seeing things we normally wouldn't see. In real life, there's a lot of the red stuff around and it coats things so you can't see it. When we have somebody who comes into the emergency department with bad traumas and a lot of bleeding, you can't see things really well, so we have to get the bleeding to stop. Oh gosh, the crunch noise, probably a distal tib-fib fracture. People break this often. It's near the ankle, makes up part of the ankle joint itself. There's multiple bones that make up the ankle joint. Oh gosh. impaled through the posterior part of their skull or the high up part of the neck going through. The amount of blood coming through could potentially happen. This is basically through somebody's brain stem in the back. The brain stem has to do with your autonomic nervous system and your functions, so it's not compatible with life. Got all the other person's blood in their face, in their mouth, in their eyes, definitely transmitting whatever potential pathogen is in the blood into that individual. You're thinking hepatitis B, hepatitis C, HIV. Those are the big viral ones that you worry about. Oh, glass right into someone's foot. Oh gosh. We get x-rays, we'll see the glass. We want to make sure that there's no broken bone. If it's going through your shoes, you got to cover for different types of bacteria. Depends on if it's a foam shoe versus a normal sneaker versus barefoot. You need different types of medication. And then puncture wounds, you need to close up or have it slightly open to allow drainage. Lawnmower blade to somebody's face. A lot of soft tissue injury. How would somebody pass away from this injury? It would have to go deep enough to cause the destruction of the brain tissue and interfere with the airway itself. Oh my gosh. Just rip it out. Just rip it out. You're screwed. Just rip it out. Oh, now you're on fire. When somebody does come to the ER with burns, we want to make sure heart rate and blood pressure are all normal. We also want to make sure that their airway is intact. If there's concern that the airway might get occluded soon because of swelling or melting of the airway, we'll do an early intubation to make sure that we're protecting them. Oh, yep, nope. I mean, what? How much body surface area did you get burned? What areas of the body did you get burned? And lack of oxygen, smoke inhalation, altered mental status from the chemicals that are being burned, or you've burned your airway so badly that it's melted away and you can't get any oxygen in.
No one gives a shit about your stupid little death curse, okay? So take a hint and leave us alone.
Oh gosh.
We're not coming for our family.
Oh my gosh. Oh, it's a compactor. Oh my gosh. That is so scary. What? What? Oh my gosh. Slow compressive force crushing the jaw, skull, and the rest of the body. Most of the time, jaw fractures we end up seeing from somebody getting punched in the face. Fracture might happen over here, and then you see another one on the other side or in the middle because the energy has to come out. They did a good job of like skull fractures open. You're gonna have bleeding because of the tissue ripping open.
That's really good. You gotta be kidding me. You're telling me you're not allergic anymore?
I don't know, man.
That's just perfect, isn't it?
My hair grew out of it.
When somebody has an allergic reaction, the first thing we always think about is the hives that we're getting. What also will happen is you'll have swelling of tissue where you feel like your throat is closing because you're having swelling of the tissue of the tongue. And then your blood vessels are vasodilating, so your blood is going out to the periphery, your blood pressure is dropping.
Hey, you're doing it. Yeah, you're doing it. Bobby, you're doing it. I can't give you that.
Emergent treatment is epinephrine, adrenaline, that EpiPen. You just slam it into your tissue somewhere, get it in your body. Sometimes you have to have multiple doses of it. It's really good to make sure that you have a 2-pack of your EpiPen with refills.
Bobby, hey.
Wait, what? Watching these treacherous injuries reminds me that sometimes life's occasional stresses can hit just as fast. That's where Chillax by my company Life Happens could help ease the tension and bring on those calm vibes. Check it out at lifehappens.com or Amazon. What the heck? Oh! Oof. Oh my gosh. Come on. I think this is called the Prince Albert. I think. bent backwards like that. Is there enough force to be able to do that? I don't know.
I don't know.
Wow. He's got a lot of facial swelling. We do see that people's faces will swell, but he got the epinephrine in there, so hopefully it starts kicking in pretty fast. It usually works pretty fast. You'll start feeling tachycardic, a little jittery, but that is normal. Keep moving, keep moving. These things weigh a lot. If they hit somebody, they're going to crush you. These cases don't come to the emergency department because they're DOA, basically. They're pronounced on scene. I believe in an earlier Final Destination, there was an issue with big trees on the highway.